Hi, this is Roger Green, host of the Surfing the MASH Tsunami podcast. This week we are offering 5 conversations from episode 23, our discussion on challenges in physician-patient communication stemming from a session at the EASL Congress. With Louise Campbell, session co-chairs Shira Zelversagi and Mike Patel, and panelists Jose Willemse and Tom Margeau. Plus, from the vault, a discussion from Shira's previous appearance on Surfing MASH in the U.S. Thanksgiving 2022 special. This episode's a bit unusual for 2 reasons. First, I'm not part of the conversation. Louise leads it brilliantly in my absence. Second, it focuses far more on the patient and the role of the physician-patient interaction in steering treatment. I found this fascinating and hope you do as well. This conversation focuses on some dynamics of the physician-patient consult. It starts with Mike asking Tom whether he reviews the patient's history before the visit. Tom says he does so because he considers preparation vital to a successful consult. That said, Tom notes the importance of being responsive to the conversation rather than using the chart review to decide the outcome of the visit in advance. He provides some empathetic detail about how important the visit is to the patient and, as a result, how important it is that he be responsive as well as prepared. Jose agrees, provides more color, and notes what she considers the most important question a physician can ask a patient, which is, how are you feeling today? To Jose, asking that question just one time a year can change the entire dynamic of the relationship. Tom then notes the scarcity of time and the double-edged demand this creates for each visit, planning in advance to use time as productively as possible, but once the patient is in the consult, giving the consult all the time it needs and not predetermining its direction. After Jose makes a point about the importance of using language precisely, Louise joins the conversation to describe the entire process as being like speed dating, with both sides having a scarce few minutes to make a relationship that will be pivotal to the patient and might last a lifetime. As I noted at the beginning of this introduction, this episode has a few things that make it really different. Focus on patients, me not being a part of it, and a really engaged panel that has diverse backgrounds. The conversation moves fast, covers a broad range of issues, so just sit back, listen, learn, absorb, and when you're done, join the conversation in our LinkedIn discussion group.
Mike Patel.
I have a question for Tom and Jose, if that's okay, Louise. You're very busy, Tom. You obviously, when you have your clinic days, you have them all lined up back to back to back to back to back. Do you find that sometimes you don't have the time to look at the patient's chart before the patient is sitting in front of you? That's my question to you. And Jose, do you find sometimes you've gone to the doctor and it's like they didn't even read your update until they're sitting in front of you, and that makes you feel that they didn't care enough to prepare for the meeting with you? I just want you guys to discuss that.
Tom Margeau.
Yeah, I think it's really good questions about the dynamics of a consultation in clinic. So I tend to look through all the patient's notes before they turn up in the clinic room. I think it's nearly impossible to run a sensible and safe consultation unless you've done your homework, even if that's kind of 10 minutes of flicking through the notes, where they are in the patient journey, what disease stage there are, what treatment. So I feel like I've tried to do my homework. And so when the patient arrives in the clinic room, I kind of know from a medical perspective what I'm looking to tackle. And that's good because you're trying to keep the patient safe and kind of keep the flow of the patient's journey, but you need to be careful that you don't then go in with preconceived ideas about what you want to fix and what you want to tackle. So you need to have yes, you've got an agenda about what you think you need to do, but I think you need to have the awareness and the flexibility to be able to adapt and prepare within the consultation, because Jose may come into the clinic room with a completely set agenda. And the other point I would make is that I've looked at Jose's story for 10 minutes, if that, 5 minutes before she turns up into the room, and then we go for it. Whereas Jose has got up in the morning, she spent the whole of the day before preparing what she wants to say. She's kind of got up early, she's navigated the traffic, she's waited in the clinic room, waiting room for half an hour longer than she should. She's rehearsed what she's worried about. She's rehearsed the questions that she wants to ask. So it's a much, much bigger deal for the patient than it is for me. And actually, I sometimes don't think we as doctors really realize, or we need to keep reminding ourselves just how big a deal that consultation over the next 20 minutes is for that patient. And it's a much bigger deal for them than it is for me.
Jose Willemse.
Oh, wow. It's wonderful that you bring this up, because that's true. That's true. As a patient, you know some weeks before that you have to go, and then you start to like, okay, what do I feel? Is there something that will change? I'm curious about my test result and things like that. I'm happy to hear that you prepare the visit of your patient, because I know a lot of doctors, or they give the impression at least that they don't do that. So they start to read when you're sitting against them. And that's why they always focus on their screen and not to you, because they have to look at that. And my biggest thing is like that I think, oh, skip that sentence is that they say, yeah, I know what you want, I know what your vision is, but you know the time, we don't have time. Stop with that. You could do 5 other things instead of complaining about that you don't have time. I asked one of the Dutch doctors, have you ever asked your patients, hey, the whole list of test results, have you seen those already? And do you have questions? Because very often they do. And are there things that you want to discuss with me? And he said, well, to be honest, I never do. I said, well, please start with that. Your patients will be very happy with that. So it's also a focus. It's a mindset just to change that. And as I say, for a patient, it's so important that you ask about, and that's my new mantra, as you know, just ask once a year, how does it affect your life? Patients are thrilled about that question. It doesn't need every 3 months, but just once a year, or how are you doing today? And if a doctor can ask that question, and patients don't need half an hour to explain that. I don't believe that.
I think the time thing is interesting because I do feel the time pressure acutely in these consultations, but the first thing I agree with you, patients don't want to hear that you're stretched for time. So I think, I don't think vocalizing that within a consultation is productive. So I think the time pressure element shouldn't be part of the consultation once you're in the room. But I think what the doctor should be doing is trying to come up with a routine and a strategy that saves as much time as possible whilst addressing your concerns. And I suppose I'm just thinking acutely about how I run my clinics. I spend a very short period at the beginning proving to the patient that I know what's going on. It doesn't have to be very long, but I think the patient likes to know that I know what disease they've got and what's happened before. And that, so just because trust is so important, you want the patient to recognize that you're a sensible doctor who knows about them. And then I actually spend a little bit of time doing context. So what do you do for a living, or what did you do for a living, and who's with you at home? I tend to ask. So just to kind of get a tiny bit of context. And then maybe I do go into the nuts and bolts of hepatology care. But maybe what we should be doing, Jose, is moving the patient agenda much more towards the top of the consultation and letting that inform things. But I do think all of this changes as you go through your career as a doctor. So as a junior doctor, you are focused on, are you going to bleed from your varices? Have you got hepatocellular carcinoma? Are we optimizing your ascites? Have we got the diagnosis? Do you need a liver biopsy? They're very much the focus. But as you become more and more senior and experienced, yes, obviously you're doing all of that stuff, but you're quicker and more adept at bringing in the patient voice. And that's why communication, patient voice, patient advocacy, sessions like this at IELTS, at Congress are so important, because it means that you instill in very junior doctors a blueprint for how to run a successful and patient-centered consultation.
Yeah, and it's also a matter of language, or how do the questions. I met the doctor and he said, what do you expect from me? So, well, a cure. Instead of, and I know that his intention was to ask me, what can I do for you? That is completely something else. And a lot of doctors are not aware that they ask the wrong questions, and they have the intention to do it right. But maybe something like that, to realize, what are you really telling? And if you leave the room, very often doctors say, well, if something's wrong, give me a call. And say, if you ever call yourself, because you're never there, or people are afraid to give a call to you because you're so busy. Doctors are always busy. That's the intention they have. And so that there is a lot of, just some small steps. Doesn't cost money, doesn't cost time. It's only awareness, how they act in the room. And it's not that difficult to make the patients much more happier.
Louise Campbell.
I'm just going to jump in there because I think the discussion that you've had, you've both answered and posed questions with answers that are really practical for physicians in the clinic. Jose, at the beginning you were talking, this is a really important relationship for a patient. It's like speed dating. You've only got a few minutes and you've got to nail it. And because you're going to base the future relationship you have with one of the biggest people in your lives for the next 20 or 30 years, particularly in the speciality of hepatology, on a 4 or 5 minute interaction. And Tom, you detailed how you can try and get that when you first meet a patient for the first time. There is certainly a potential role for allied health to do some pre-counselling, what are are your biggest concerns when you see, let's make that easier, let's make that fruitful interaction? Is it something to solve some of those challenges? Because nurse specialists and nurse teams around hepatology are skilled. Do they need to preempt and pre-prep? Would that be beneficial? It certainly works very well in the cirrhosis program about keeping that maintenance, because you do get to know people personally. That was something that came out what you were discussing there. Is there an effort to pre-prep a specialist clinic to know a little bit more? Are you coming with somebody? What are the difficulties if you're getting here? Would that be, how can we facilitate? And I know everyone listening to this is going to scream, we just don't have time. But actually it's about how you spend quality time in healthcare to improve the quality of care, reducing load in the future in these areas. Is that something that can help navigate the challenges that you were describing?
And now, back to Roger.
We hope you've enjoyed this recording. If you have any comments or questions about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded the conversation, or send an email to questions@surfingmash.com. It's not clear what we're going to be doing next week. We're looking at approaches featuring NITs and a separate one focusing some basic science. Either way, I'm sure it'll be fascinating, and I can't wait for us to put it out for you next week. Until then, stay safe, surf on. We'll see you on podcast. Bye-bye now.